Hello, I am Michelle Gillihan, MSN student, Aspen University. This video will briefly discuss the benefits of including mental imaging when teaching motor skills. This video will introduce three scenarios developed for different teaching activities. The first one to use in interprofessional collaboration, the second one for translation into a simulation, and the last one for use as a debated subject in an ethics course. The video will conclude with the reveal of a game I developed to help learners review the instructional methods discussed in this module. Mental imaging, otherwise known as mental practice, is defined as visualizing a skill without any body movements before performing that skill. Mental imaging is an alternative teaching strategy for motor skills and can enhance student learning. Mental imaging is an excellent tool to use during instruction on intravenous or IV access. The student should mentally visualize assessing and selecting the vein, cannulating the vein, and applying the dressing before starting an IV on a real patient. I continue to use mental imaging when faced with a difficult IV start, a frequent situation in the ED setting. The first scenario will discuss developing an appropriate interprofessional scenario for the undergraduate healthcare students, nursing and non-nursing alike. The World Health Organization defines interprofessional education as students from two or more professions learning about, from, and with each other, increasing effective communication and improving patient outcomes. Let us quickly go through the steps. 1. Identifying the who, what, why, and how of the scenario. 2. Going into the field. 3. Supplying supplementary data. 4. Double-checking the scenario. 5. Integrating and evaluating the scenario. And 6. Revisiting, revising, and refining the scenario regularly. The developed interprofessional scenario involves a child frequently taken to the ED from school because of asthma exacerbations. However, the child rarely requires a visit to the ED when home. The child uses a steroid inhaler daily and has a rescue inhaler and a nebulizer available at home and school, along with specific guidelines from the pediatrician. What is happening at school that initiates the exacerbation, or is the school staff fearful of the asthma attack and takes the child to the ED without first following the guidelines provided by the pediatrician? Next, I will explain how I use these steps in developing the scenario. First, I designed this scenario to incorporate several professional healthcare students, nursing, medical, and respiratory therapy, and non-healthcare students, education, and school counseling. The main issue of this scenario is the child needing frequent trips to the ED for asthma exacerbations when at school, but not when the child was at home. The purpose of the scenario is to understand why the situation is happening and find a solution. Next, I retrieved a clinical case from the field and incorporate actual supplementary data to maintain authenticity. I double-checked the scenario with other ED nurses and received positive feedback. I will complete the last two steps, integrate and evaluate, and regularly revisit, revise, and refine after incorporating this scenario into an educational program. The best simulation scenarios are the most authentic, based on actual clinical cases. For the second scenario, I will present a clinical case that translates well into simulation. The scenario involves Joe, an elderly man who lives alone except for his dog, who ambulates with a walker and can do most of his ADLs to an adequate degree. Joe has a pertinent medical history of type 2 diabetes, hypertension, mild renal failure, and COPD. Joe has a caregiver 3 times a week, Monday, Wednesday, and Friday, to set up medications, pick up a grocery list, provide light housekeeping duties, and most importantly to Joe, provide companionship. When the caregiver arrived on Monday morning, she found Joe on the ground in the living room near a chair and side table and called EMS. EMS arrived, put a cervical collar on Joe, placed him on a backboard, and then transferred him to the ED. Joe is alert and oriented to person and place, but does not know the date or time, and tells the nurse he tripped over his dog but can't remember when, hitting his head on the side table, and was unable to get up due to the pain in his left leg. Joe has a cell phone, but it was out of reach. Joe had access to a water bottle and his inhaler because they were sitting on the side table. A quick across the room look at Joe reveals a hematoma to the forehead and a 3 centimeter laceration to the left side of his head, covering in dry blood but not actively bleeding. Joe's left leg appears shortened and externally rotated. Joe has been incontinent of urine and stool several times over the last 48 hours or so, and his clothes are saturated with bodily excretions, creating a foul odor. Joe repeatedly asks about his dog and frequently yells, "I am not going to a nursing home when I get out of here." A model, someone trained to act as a patient, is a more effective method to teach fundamentals to nursing students than lectures and laboratory practice with a mannequin. So I will encourage using a model in the simulation. The scenario will provide education in all 3 learning domains. The patient presents with many needs, both physically and emotionally, providing the student with an opportunity to work on cognitive skills by prioritizing these needs by severity. This scenario also teaches about distracting injury and circumstances. The soiled clothes may be offensive, but the possibility of a brain hemorrhage is a priority. A hands-on physical assessment will provide the opportunity to build psychomotor skills. Working with Joe's emotional stress, including worry about his dog and his fear of going to a nursing home, will provide effective domain involvement. This scenario also provides for collaboration with case management and social services if desired. My role as an educator is to point the student in the right direction, giving feedback when needed, and allowing the student to use their critical thinking to decide the next step. This scenario provides for debriefing as detailed as the student gets within the simulation, discussing safety measures in the home that might prevent this type of incident, providing emergent care in the ED, and discussing the patient's disposition when he is ready for inpatient discharge home, temporary rehabilitation, assisted living, or skilled care. I developed the final scenario to use as a debated subject in an ethics course. A 16-year-old with a terminal diagnosis of a debilitating neuromuscular disease wants to sign paperwork stating no resuscitation. The parents disagree with the 16-year-old's decision and want everything possible done to save their child. What do you do? An ethical dilemma is complex. The solution is not black or white and may not be singular, but several solutions in shades of gray. Students need to understand there is no right or wrong answer in an ethical dilemma, a concept that may be difficult to grasp. Educators can use games to motivate, reinforce skills, promote collaboration, and provide quick feedback. Today, there is a heavy focus on digital or video gaming, although the educator can include any game type when promoting gaming in education. I developed a crossword puzzle to help learners review the instructional methods discussed in the current module. I wrote 20 clues in easy to medium range of difficulty. I will download the crossword puzzle, clues, and answer key as instructed. Marrying the knowledge content with the correct teaching style to produce student understanding, retention, and behavioral change is the educator's end goal. We are fortunate to have a plethora of resources, and this video briefly touched upon several. I discussed the benefits of incorporating mental imaging when teaching motor skills, offering starting IVs as an example. We looked at 3 scenarios developed for different teaching activities. I will quickly remind you of these scenarios. The first scenario involved an asthmatic child with frequent ED visits for exacerbations while at school, which I developed to use in an interprofessional collaboration for healthcare and non-healthcare professional students. I created the second scenario from an actual clinical case for translation into a simulation. The scenario follows an elderly man who fell at home, laid on the ground for an unknown length of time, and was taken to the ED, providing learning in all domains. The last scenario was developed for use as a debated subject in an ethics course. It involves a teen with a terminal diagnosis of a debilitating neuromuscular disease wanting to sign papers stating no resuscitation while the parents are advocating for every possible thing to be done, including resuscitation if needed. Lastly, I revealed a crossword puzzle, I developed to help learners review the instructional methods in the current module and download all the materials instructed. Thank you.